what is endometriosis? What are the symptoms? You know, what kind of patients are coming to you? What are their complaints?
So endometriosis, so this diagnosis or this disease is actually, it's a really hard one to nail down for our patients, which I know is not a surprise to a few of our panelists, but it's typically the way that it happens is it's usually endometrial tissue. So your endometrium is a layer of the inside of your uterus you shed every month when you have your menstrual period. And what can happen is certain glands from that tissue and from that endometrium can actually be found in other parts of the body. And so that tends to be what is defined as endometriosis when they find that tissue in other areas. What's unfortunate is that this tissue actually responds to your hormonal cycle, just like your endometrium. So typically the patients that suffer from this diagnosis typically end up having cyclical pain. They usually end up with pretty severe menstrual pain or premenstrual pain, usually right before their onset of their menses. And it can be in where those implants are. So sometimes that'll be on the bowel. So they'll have some GI distress. So things like constipation, diarrhea. It also can be on other areas and other pelvic organs. So that can cause pain with sex. And it can actually lead to scarring and adhesion as well. So it can be extremely uncomfortable. And it can turn into a situation where it's not just uncomfortable and painful during the times that you're on your periods, but all the time. And so I can share the floor here with Dr. Vilasagar if you want to add more, but it can be a pretty debilitating diagnosis. And I know, at least on the resident standpoint here in Atlanta, we see a decent amount of patients with this diagnosis, and it actually can be hard to nail down. And I'm here to also learn from the panelists about their experiences as well.
Yeah, I think that was great. I'd love to add to that. So you're absolutely right that it's cells that are acting like the cells of the endometrial cavity, the glands and stroma there, and those endometrial-like cells can implant elsewhere, causing this huge variety of symptoms. And there's overlap of symptoms with endometriosis and other conditions. As you mentioned, sometimes it can be confusing. I think you went through a lot of the type of symptoms that we see. And to add to it, we know that this causes the systemic inflammation that can then lead to overall fatigue in general, significant bloating that women experience, nausea, vomiting, GI symptoms, pain with just eating in general, even like a mental fatigue, mental fog that can happen. And we traditionally used to say it's associated with your period, cyclically with your period, with the cycle and hormone fluctuation. And we see that it can spread beyond that too for multiple different reasons, and chronic pain conditions can set in. So we see a huge symptom overlap. I think it can make it confusing for many people to diagnose because they might present with GI symptoms or infertility. Alternatively, we see this huge spectrum where women may not have pain and they present with difficulties conceiving or becoming pregnant. And then that leads to this continued delay in diagnosis because that's not a reason alone maybe to go to surgery, which is the definitive way to diagnose it. So we see huge variety of symptoms and overlap. And I think it's important to note that it can be anywhere on that spectrum for any of the women. And I love to hear from the other panelists and patients too who have gone through this. But yeah, that was great as far as what it is.
Yeah, you know, I'm going to turn the floor in a moment to Alana and Nenji to kind of share their specific experiences as patients. But it sounds pretty debilitating in terms of this key symptom being pain. And so I want to know, Dr. Vilasagar, you know, is there a cure? You know, so a patient comes to you, you've diagnosed them with endo. We'll kind of skip the diagnosis process because I want our patients and our advocates to talk a little bit more about that. But is there a cure, and how is it managed or treated if someone comes to you with that diagnosis ultimately?
Yeah, there's no absolute cure for endo. So we can't say, here, take this medicine and it's going to, you know, regress or dissolve these lesions. We wish, but these cells that implant elsewhere and are causing this growth, cause this surrounding inflammatory process, scarring, fibrosis. So we have to remove the disease and remove that other scarring that's around it, because eventually the pain can be caused by that distortion too. So when we talk about a cure for it, we the thing that is most like a cure is removal or excision of this disease. So that's going to offer the most optimal long-term outcomes of pain relief and improvement, optimizing fertility. Also, removing that inflammation up front is going to help in the future for fertility, or currently if that's a goal. And it's also going to give the diagnosis. So we know we can't diagnose endometriosis. We can suspect it based on symptoms. We can't diagnose it until surgery. We remove it. Those specimens go to the lab, they get tested, and it's confirmed that way. So while there's no cure, again, that we can do this, and, gosh, even after full excision surgery, it's a chronic condition and it can come back. So there's no way to stop that, unfortunately. When we do intervene, we're intervening because of symptoms. Again, that debilitating pain that's affecting quality of life or fertility goals. So when we do that, we want to tailor treatment for a patient, but then also talk about maybe managing symptoms downstream. And so medications can help with that. Again, symptom management. Unfortunately, they're not going to stop progression or recurrence of disease. Some studies have shown some medications can prevent recurrence, but again, there's nothing that's going to be an absolute cure.
We have platforms. We are, on social media. We have our website. We have, the Instagram, Twitter, everything, and we are very accessible to, to women. I mean, we do a lot of social media and TV interviews and things like that. So people really know us quite well. So it's so easy to join our group. It's so easy to contact us, and we always have people, women asking us and girls asking us about issues, and so we encourage that kind of interaction. Yeah. So so I think maybe that's the most I can say about that.
Yeah.
Thank you.
And right before Sandra answers how we support her, because Dr. Vilasagar has to leave us for the evening. We're right up onto that hour and a half time. I did want to let her answer one of the audience questions that came up multiple times privately and publicly about what are the different stages of endo. And when we kept saying, stage 4, like Alana now has, and stage 3, et cetera, what that actually means. So before you leave us, can you do that?
Yeah, that's an excellent question. Happy to stay for a couple and answer that. So traditionally, endometriosis was staged much like we see with the cancer diagnosis, and surgically, those of us removing it knows that it follows no rules, much like cancer. Also can infiltrate anything and causes really this really quite significant scarring and process of fibrosis and sticking everything together. Stage 1 involves lesions and these cells that implant in smaller sizes and superficially on the lining or the covering that we all have, covering all the organs internally. And then it progresses to stage 2 and 3 and 4 as it progresses onwards and advances. And that is typically due to the combination of endometriosis cysts, endometriomas, which are insanely inflammatory and stick to everything around it, which is typically the back of the uterus, the rectum, the sidewalls where the ureters are. Those are the tubes that carry urine from kidneys to the bladder. So very important blood vessels, nerves, structures everywhere. And so we see it progress from the superficial disease to this advanced stage 4 disease, we call it, which is a frozen pelvis, everything cemented together. And stage 3 and 4 are typically involving those endometriomas. So when we hear about chocolate cysts and endometriomas, the first thing we start thinking about is, well, where are they in their advancement of disease, and what's the surgery going to be like? Are we going to be involving, doing bowel surgery or anything else, and routinely living around all of these structures and as I mentioned, the sidewall structures like the ureters. You guys are all very well versed with all of these anatomic structures. I know because you educate yourselves and know about where endometriosis lives. So those are the stages. One thing I want to mention with the stages is that doesn't correlate to your symptoms. It doesn't mean that because you have stage 1 disease, you're barely going to have symptoms, or you might just have a little pain with your period. Or if you have stage 4 disease, you're going to have the worst debilitating pain in the world. It does not mean that. And so I'm not routinely staging every single surgery, because what does that mean in the future? I describe everything, every single finding as descriptively as possible. And I will always comment on stage 4 disease, because that will potentially impact a future surgery if there is one, and know that there could be bowel involvement. There could be potential of a bowel resection. And just as we've talked a lot about the approach for care of endometriosis in the outpatient setting being multidisciplinary, involving mental health, involving every system, and making sure, we touched on physical therapy, sex therapists, just making sure we're covering all aspects. It's really important in the operating room to have a multidisciplinary approach and a team approach too. So us as doctors and surgeons hearing our patients, hearing the symptoms, if you're telling me about severe rectal pain, well, then the next question is, are you having blood in your stool, especially during your period? And is that then going to prompt a colonoscopy preoperatively, and me predicting, or knowing based on your exam and the questions and the history you're giving me that I might be expecting stage 4 disease based on a lot of things. So just important to know that even with stages, that doesn't mean that is going to equal the extent of the symptoms that you're having. Very mysterious condition and enigmatic, and we're learning more and more and more about this.
Themes that I heard from every single panelist: number 1, advocate for yourself, speak up, document, keep notes, ask questions, and for doctors, make sure that you're providing questions and notes and answers. Number 2, take care of your wellness and your mental space and your soul, because endo is much deeper than just pain. It's really about making sure that you are in a mental state of support. So whether that's finding a therapist, whether that you need to, talk to a psychiatrist about elevating to medications or whatnot, really doing your due diligence in that way. Number 3, finding places that are educating. And I'm so glad that, I'm here as a Black OBGYN project. I'm trying to bring together organizations. So being able to learn of, filling empty wombs and learn of Endo Sisters East Africa is so empowering, to partner with organizations like Period, where we realize that menstrual health and well-being is actually all systemic health and well-being, and educating both doctors, policymakers, communities about it, talking to our girls and boys about this early so that they are aware of it early. It sounds like a huge theme, and there was so many other gems, but those are the ones that popped out at me. I just want to say thank you to each and every panelist here. I know Dr. V had to leave a little bit early, but it has been so humbling